we're not competitors. We're all in this together. And as the field grows, there's a spirit of respect and effectiveness, and there's many ways to do this. And as we grow, the profession grows. And that's what I think is really nice about this, is we enjoy being here. And we enjoy honoring somebody else. So I thought this panel was a great deal of fun. Really a pleasure.
I'm Elman, and I am a hypnotist and certified master trainer with IAC and IMDHA, and I'm really thrilled to be here. I have a Bachelor of Science in Education, Elementary Education and Special Education. Did sales and marketing in New York City for 14 years. I'm an artist, and I have a mobile arts and craft company. And then this gentleman here, John Michael Andrews, came to visit us and interviewed Larry and about his father, Dave Elman, and stuck. I don't remember. Larry thinks it was my head or the table, but somehow or other he stuck my hand somewhere. And I said, I want to do this. And so I then started training to be a hypnotist, not knowing that I actually had stopped smoking with hypnosis 16 years earlier, and I knew that it worked. So I've been very, very lucky to be traveling with Larry and speaking around the world on Dave Elman, and I'm getting to learn from everyone, everywhere I go, including all the people at this table. So thank you to all of you. Dave Elman was born in 1900 in Park Ridge, North Dakota. He died in 1967, but he had a very varied life and career in between. He grew up in Fargo, North Dakota, and he was inspired to explore hypnosis when his father was dying of cancer, and he watched the effect of pain relief with a visiting hypnotist and how it worked with his father. So he started playing with it, toying with it, and kept bringing that induction shorter and shorter. He then went into vaudeville, where he was a musician, comedian, bit player, and a hypnotist. And in the 1920s, he was in New York, and he worked with W.C. Handy, writing music. In 1937, I'm giving you a very encapsulated version, because you have a lot of people here that would be happy to talk about any one of these things. In 1937, Dave launched his career in Hobby Lobby and had a radio program, which I think really helped him to be able to help people visualize what's going on, because they're all seeing it in the studio audience and they had to be brought in, just not being able to see the hobbyists, just getting to understand what was going on stage by him reframing and describing. In 1949, he was asked to demonstrate hypnosis by a group of physicians, and the rest is history. So that is my short introduction. We're going to go down and have the panelists briefly introduce themselves and share maybe 2-3 minutes of their greatest takeaway from studying Dave Elman's methods. And I think we'll not start with you. And also Stephanie, for the panelists, Stephanie is right here, and she's going to help keep it within time. So about 2.5 minutes for an answer when we're asked, so that because I know each one of us can easily speak for 50 minutes on a topic, with no problem. Okay? So, Teresa, if you would introduce yourself, please.
Hi, I'm Teresa Van Zeller. I'm a certified hypnotherapist. I was certified through NGH. I teach Roy Hunter's hypnotherapy program in LA, and I also have my own hypnobirthing program. And I have been quite fortunate. You know, hypnotist takes 1 or 2 times working with somebody, and you're the specialist in your area in that. When it comes to pain management, it was unexpected, intense, and quite frankly, I was scared to death at the time. And it's amazing how great these techniques work when you need something to work quick, fast, and efficiently. And to see that when you've got a relative or a loved one that's in a great deal of pain and they haven't been able to manage it, and you walk in, if you never help another human being, it's just such a rewarding thing to be able to do that, and to be able to do it on a regular basis successfully, time after time again, is just excellent.
Thank you. Roy?
My name is Roy Hunter, and my original hypnosis instructor was Charles Tibbetts back in 1983. One of the required textbooks was the Dave Elman Hypnotherapy. So Charlie was a fan of Dave Elman. In a sense, I'm fourth generation Elman, in that Elman taught regression to Gil Boyne. Gil Boyne taught regression to Charles Tibbetts, and I learned regression therapy from Charlie, and just a couple of years ago co-authored a book, The Art of Hypnotic Regression Therapy, with the licensed clinical psychologist, Dr. Bruce Eimer, who also is very aware of who Dave Elman was. So in addition to that, I've traveled around the world and been privileged to give workshops, and a number of different professionals in different countries definitely know who Dave Elman was, including a group of psychiatrists that I was privileged to teach hypnotherapy to in Singapore a couple of years ago. So I'm definitely a fan of Dave Elman, and I believe that history will demonstrate that Dave Elman was perhaps one of the most legendary hypnosis trainers of the 20th century.
I'm Seth-Deborah Roth. I'm a retired nurse anesthetist now, and certified hypnosis instructor with the NGH, and my specialty is medical hypnosis. That's what I do, and the Elman methods, the inductions are part of the base of what I do with my clients in teaching, in my work with them, and also in teaching them self-management. It's really the basis of everything I do with medical hypnosis. My stuff is going to be short. I'm a New Yorker, things are to the point.
Hi, I'm Michael Elmer. Dave Elman's medical hypnosis practice was born in 1949. I was born in 1949. Make up what you will of it. What I found very, very exciting and continue to find exciting about Elman's work was his flexibility, and that he was always looking to streamline and improve and change. And even when something was very effective, he saw ways to make it more effective. One of the biggest challenges to hypnosis as a medical modality was the length of time it took. And he looked at that and said, "No, that's unnecessary." And I think that he set a new standard in how one could think about an induction, and that deeply impressed me. So I think that there is a standard of professionalism that he demonstrated. I think he clearly was an innovator, and I'm delighted to be on display.
My name is Sean Michael Andrews, and I'm a hypnosis instructor, and I've traveled around the world teaching Dave Elman's methods. I've taught nurse anesthetists and anesthetists in Australia using the methods that Elman developed during the 1940s, 1950s, and 1960s. His induction is absolutely my favorite induction. It is the most effective induction that I've ever used. His methods, as Michael said, are fast. I like fast things. I don't like to waste time, and his work is pretty much the basis for all the clinical work that I do.
I'm Jason Lynette. I'm an instructor. I see clients, and my journey with all of this was, I began my career in all things hypnosis by learning stage hypnosis. And the first thing I ever purchased was, this is word for word, memorize these words, that should work. So I went through training originally going, let me find the why, let me find the understanding. And actually, by going through that journey, learning from a lot of people who are up here with me now, seeing the formula behind it. So repeated time and time again in the Elman text and the recordings, is if you understand the formula, there's not a person you cannot hypnotize. And even take that formula of just that model of the opening wedge and bring it into the context of what that client has to go through to produce change, then there's really not an issue that we can't begin to help somebody with. Whether it's relieving the symptoms of this condition, whether it's helping them to overcome a behavior or a fear. Once we have that opening wedge in there, then it's just a matter of compound, 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 and we get more into the context of the process of creative change and not caught up so much in the content of what's going on. That's been my greatest takeaway.
I'm Larry Elman. I'm Dave Elman's son. I went through his course 3 times. The first time at age 11. If you ignore the nurses who sometimes were brought to the class by the doctor who employed them, I'm the only non-physician to ever graduate Dad's course. It helps when you're related to the guy who's teaching. I went off to MIT, served in the Air Force, found out doing hypnosis in the Air Force is a career-damaging mistake. So for a number of years, I was relatively invisible in the hypnosis world. I kept up with it, but I wasn't very active. After retirement from both the defense industry and the Air Force, Sean Michael Andrews found me and wanted to interview me, which was fine because I'd given many answers to questions about my father. And by the time he left that day, having stuck my wife's hand to both the table and her head, she was into being trained in hypnosis, and I had my arm twisted to go back into the field. And I've been teaching and lecturing on it ever since. So that's it in a nutshell.
So I'd like to open up, yes?
Was I shorter than you expected?
You did really good, huh? So I'd like to open the floor to questions. If anybody would like to ask a question. You told me you had questions.
Well, I was going to ask about, I know you said in hypnotherapy that it was impossible to quit smoking with hypnosis. We now know it's not really the case. So at that time, was anybody able to use hypnosis for quitting smoking?
Would anybody like to take that?
I think Colonel Elman should take that one.
Okay, my father had a big ego. It may well have been well earned, I'm not disputing that. But to give you an idea of the size of his ego, I remember one day he nudging me and pointing to a colleague said, "That's the only hypnotist in the world who's better than I am." So he had quite a big ego. Well earned, but big. He was under some pressure to give up smoking. He tried to do it with self-hypnosis. Now, we all know today that you can't have somebody quit smoking unless they really want to. Many of you will ask a smoking client before they come in, on a scale of 1 to 10, how much do you want to give up? And if they say 2, or my wife's sending me on maybe a 3, you politely decline them. If they are 8 or up in that general vicinity, you know you can work with them. But that had not dawned on my father, so he tried self-hypnosis for curing smoking when he didn't want to give up the cigarettes. It failed. Now, his ego is the best man on the entire planet has just failed. Therefore, it must be impossible. Now, but it goes a little further. The physicians in his class would ask him to work on somebody. Well, I've got a patient who's got emphysema. If I can get him off cigarettes, I can treat him. Mr. Elman, would you please work with that patient? Now, how many of you have found in your own practice that if you show hesitation, the suggestion doesn't take? All right?
Absolutely.
So you have my father, who has convinced himself that the world's greatest hypnotist can't cure smoking, trying to cure a smoker who may not want to quit. You put that together and what do you get?
Not success.
Failure. You have this happen 3 or 4 times and up comes this comment in Dad's book that the only addiction in the world that hypnosis can't cure is smoking. And ever since I first started teaching on this about 6 years ago, that is the commonest question I get.
Interesting, very cute.
So I have 2 insights on that. The first insight is we have to remember the period and time. Smoking went out of favor recently, relatively. There was a time that people thought of smoking as actually being healthy. And so I think that has a lot to do with it. Far fewer people were interested in quitting. It was fashionable to smoke. And that was a completely different time. The second is, I think, regardless of how good a hypnotist is, practicing self-hypnosis is often less effective. They're 2 different dynamics. So had he worked with another hypnotist, he might have had a different experience. And in terms, you have a client and they're really not committed to quitting, that's when you employ slap therapy.
I oftentimes have likened the concept of hypnotherapy versus self-hypnosis with clients by saying, I can lift a chair, no problem. But if I'm going to move a couch, someone on the other end needs to help me lift it.
Oh, I like that.
And
I like
most
that.
clients who want to quit smoking need someone else to help lift the couch and the subconscious.
I love that. That's
Yes.
beautiful.
I like that.
Comment by Roy Hunter.
It's also interesting that the other textbook, when I studied under Charles Tebbets, was Hypnotism Today by Lacron and Bordeaux, written back in the 1940s. And that book also said that hypnosis did not help with tobacco addiction. And yet Charlie said if a smoker really wants to quit, hypnosis can help make the difference, provided the client can believe both consciously and subconsciously that he or she can quit. But the bottom line is they have to want to quit. So I've made it a point through the years to make sure during the intake they're there because they choose to and not because they've been forced to. And since it's on topic with the smoking question, I'll just mention years ago a lady called, scheduled a stop smoking session with her husband, and I said, does your husband know that you're doing this? She said he agreed to it and he asked me to call. When they come in, the tension was so thick you could cut it with a butter knife. And it turned out, and I didn't find this out until later in the intake, they'd been arguing for months. And when that became apparent, I looked at my client, who was not yet a client because I wasn't sure I would accept him, and I said, by the way, I have a policy that any client who wishes to have a supportive friend or relative sit down on a session may do so, but you're my employer, and it's your decision whether or not you want somebody else present. And he said, you mean she doesn't have to be here? I said, that's your decision, not mine. And he said, honey, go wait for me in the lobby. And she slams the door, storms down the hall with a swear word in between each step, making sure it was loud enough that I could hear her. And he says, thank you. I said, now I need to ask you a question that your wife wouldn't let you answer. Do you choose to quit smoking? And he said, that's the problem. I don't like to be manipulated, and I'm so tired of being nagged about it that I really don't know whether I want to quit or not. So I said, and this question has worked in numerous times through the years, I said, if it weren't for your wife's nagging, would you be a smoker, an occasional smoker, or a non-smoker? And without any hesitation, he said, I would have quit 2 years ago if she hadn't been nagging at me. And then I said, do you realize you've been smoking 2 years longer than you wanted to? Just because of your wife? And he literally dropped the pen on the clipboard and said, I never thought of it that way before. He succeeded totally, but backslid once. when he backslid, it was several weeks after he quit because they were watching a movie on television, and his wife said, "I'm so glad I finally made you quit smoking."
Oh, interesting.
So when he came back in after backsliding, I said, after I asked him what happened, he said, "Oh," I said, "do you realize you allowed your wife to manipulate you into backsliding?" And he said, "I knew you would say that." A year and a half later, he came back to see me for a totally different issue and had not had a cigarette since. But he had to do it because he chose to. And I've emphasized that with my students over the years, because I've turned away several clients when they weren't there because they were ready to quit, only because they were manipulated. I don't want them to waste their time and money.
Thank you, Ray.
You're welcome.
Just an aside, we're here to help people change their perception. So if I have someone who says they're unsure about wanting to quit, I play with that. And I might say something along the lines, you know, I've discovered that secretly every smoker wishes they were a non-smoker. And just let them deal with that.
Oh, I like that.
Waking hypnosis is a wonderful thing.
Okay, do we have another question for the audience? Yes.
Can I ask a quick follow-up question, Colonel Elman? Do you remember who your father was gesturing to?
Oh, yes, yes. He was gesturing towards Jacques Romano, whom I came to know rather well. There is a biography of him available, obviously out of print, so it's used copies, but it is available on Amazon. I know because I own 2 copies of it. One that I've had since I was in high school, and then couldn't find when we were unpacking my book, so I bought a second one. So I know you can still get it, but Jacques Romano, he spent some years when he was quite young, teenager, early 20s, in a Tibetan monastery. And the Tibetan culture and the Tibetan religion stresses what you or I would call self-hypnosis. I don't know what their word for it is, but the concepts and the mechanisms are identical. So he became very adept in that, and then began to think his way through of, if I can do that on me, who can I do it on besides me? And when I knew him, he was in his 80s and still, as you just heard, amazingly adept. He, by the way, entertained at my bar mitzvah, so I knew him from there. And then on a couple of occasions, I saw my father ask him to guest lecture at Dad's classes, and he would announce to the doctors, there are large portions of the human anatomy that can be controlled by your mind that you don't believe can be controlled by your mind. Now, will some of you instrument me? And they would put blood pressure cuffs and anything else they had all over him. And he would stand at the podium and he would say, "Now I will stop my heart from beating." And all of the instrumentation, remember this is in the 1950s, so they didn't have all the things we have today, but all of the instrumentation of the 1950s would show that his heart went, and he would continue to lecture for 5 minutes.
Whoa.
Then take a drink of water, all of this while standing up, and I'm sure the drink of water was for showmanship, and then say, "Now, gentlemen, do you want me to restart it?" And then do that. And I'm watching physicians, he's not dying from this, but they're having heart attacks. And I've seen him do this several times. It was hypnotic self-control. I am not advocating that anybody in the room I'm not pushing him out of it. I put this up on the internet at one point and received all sorts of hate mail claiming that I was a liar. And it got rather intense, and I finally replied, "Ladies and gentlemen, I told you what I observed. I didn't tell you how he did it. I didn't tell you anything else. I told you what I observed. I told you truthfully. It's up to you to figure out what he did." I'm sure whatever he did, he learned in Tibet. And I'm sure I don't know what it is.
Question? Yes, Adrian.
In doing the Dave Elman induction, does it test somnambulism or does it create somnambulism?
Both.
Well, let's talk about somnambulism. There are many definitions of somnambulism, and you can get deeper levels of somnambulism. I think the important thing is that when you do the Dave Elman induction and the client displays the amnesia, you can be relatively certain that at that point you can do things for pain relief, which some say that you absolutely need somnambulism for. So I would just say that there are different definitions of somnambulism. However, if you do the Dave Elman induction and you do it properly, you get the amnesia, you now have a very good workable level of trance where you can do pain work, you can do regression work, you can do all sorts of work. And one more thing I just want to point out is that studies have shown there's absolutely no correlation between depth of trance and the ability to make a change. I've had clients that were beautiful somnambulists and they didn't lose a pound. And I've had clients that I wondered, were they really there? And they did tremendously and lost a lot of weight. So I would just say that Dave Elman induction will definitely get you the level of trance you require to do your therapy. And we can argue about what somnambulism is and some of it.
So I agree. And I would point out that what interests me about this statement is Elman was effective because he said so. It's a very important element in any discussion about the work we do. He was a man of convictions. He believed in his opinions, and his expectations reflected that. And I think that captured all these experiences that he recounted. So I think that's equally important to any discussion about what's going on in the field, is that when a person is highly skilled and believes in what they're doing and there's a conviction, their effectiveness reflects that.
My thought would be on that as we start to talk about depth, and depth is a conversation that could be its entire 3-day event. But as we start to talk about it, when we're testing for this specific layer, they may already be lower, they may be elsewhere on a different chart. So my take on that question would be that, and this is what I learned from Larry, the moment of being amnesia by suggestion. So on the client's conscious mind, do they know that those numbers continuing on would exist? Yes, but they've accepted into a premise in which they can take the suggestion that it's as if they're no longer there. So do they create somnambulism or do we discover somnambulism? Yes, this one or that one, the answer is only yes. Because they may already be there, but then if they're not there, then this specific set of suggestions is going to suggest them there anyway. So they may already be landing, but we may just be catching up for the ride as well. Either way, we're getting there, and I think that's the bigger point.
We have a lot of analytical clients in the Seattle area because of Boeing. So a Boeing engineer came to me to quit smoking after I'd only been 2 or 3 years in the business. And when I did the follow-up phone call, he said, when I left your office after the first session, I would have sworn in a court of law on a stack of Bibles that I was not hypnotized. But he said, I made 12 other attempts to quit smoking. And he said, it's been so easy, I can't believe it. And he said, proof is in the pudding. He said, I know I was in hypnosis in your office now because I feel like a non-smoker. And he never got past the light level, obviously.
I saw you had a question?
Oh, I had a question about amnesia and hypnosis. Now, I've been a hypnotist now for 6 years. I do the Elman induction in its what I was taught as a pure form. Have heard Larry talk about this in various varieties. I've created hypnoanesthesia for myself. I've never experienced as a human amnesia for anything, and yet I've had anesthesia. So can you talk a little bit about that? How important is the amnesia, and why do we use that as a level? I just want to hear some more about amnesia. I know it doesn't have to be for numbers, for example. I have had the experience of having a client just freak out, and I didn't realize she had been an accountant. She wasn't now, because I know better, right? Right? You don't. Certain people, you don't want to lose numbers. You can lose. My heart, I'm thinking they're just playing along, because that's what I'm doing when I'm the client.
Though if they're playing along, let's use a more friendly term of compliance. If they're in that act of compliance, they're then having to follow the suggestions in order to be compliant, which is a conversation, again, we can go back in circles around. I would go back to one specific point, though, which is a question you didn't ask, but the question of losing the numbers and the analytical person with numbers, to which my game would be, how do we make that more effective? And suddenly one day with the accountant, I think, wouldn't it be easier if your job was just a little bit easier? I'll show you how it is. And we're going to relax the rest of them away so you don't have to deal with them while you're in here. And she stopped at 99. So to say that the analytical, to say that the person whose life is dependent on numbers won't let them go, if we present a context, then they'll be very happy to do that.
That's what I thought.
Excuse me, did I understand that you've been able to achieve anesthesia with hypnosis?
Well,
Is that what you said?
for myself, yeah.
For yourself, yeah. So you're obviously a good subject. Many people would define that as somebody who's achieved somnambulism. But I've had very deep clients who are just not going to be amnesic. They will not accept it. So, but that would meet my definition of somnambulism.
I'd say that the reason that the test is done the way it is goes back to what were my father's students. They were all physicians with a very rushed schedule. Of the many tests you can give for somnambulism, that happens to be one that is fast, convenient, and fits a large body of their patients. So it's a case of, for that scenario, it's the best test. So that's why it's used. Does that mean that it's the only test that we, with a different scenario, we're not booking a patient every 10 minutes. We're booking a client for an hour or whatever. So could we use some other method? Sure we could. I do teach that you should strive for somnambulism because, as was already said, it means that when you go to do change work, regression, various other things, you know you're going to be highly reliable. So you strive for that as a working state. As to which test you use for it, you have a greater flexibility. The number one is very good because it handles a very large segment of the population. But if you hit somebody who it's not working on, swap to some other test. Either test for amnesia of something else, or go back and say, what other symptoms, tests, whatever word you want to use, for amnesia exist. For somnambulism exists. Amnesia is one. Anesthesia is another. Hallucination is still another. Pick one. I happen to stick with amnesia because I'm comfortable with it. If you're more comfortable with one of the others, go for it.
Just as a thought exercise, let me point out that all of these phenomena have been demonstrated without conventional entrancement. So everyone in this room might have had a bout of amnesia in a particular situation, temporary, and suddenly it's on the tip of my tongue, where the hell, what's that name? And then suddenly it bounces back. And the same thing is true of pain. Many people in certain circumstances and contexts have extreme pain and are unaware of it. until whatever is going on passes. So all of these things can occur naturally. And I believe when we begin to look for structures that we could use for what a client can identify, if I do this, this will happen, it adds to the effectiveness of it. And the idea of flexibility is you don't want to paint yourself into a corner. So you want to be aware of different phenomena that if we do this, you can expect that. And I think that that's part of what we're discussing as an Elman approach. Elman was flexible. He isn't here to say, yeah, I had a lot of options. I had an interesting toolbox. He codified something for a specific group of people who, in a way, even though they were the most open-minded, were quite rigid in their worldview. And I think that's reflected in everything we're talking about, is who the client was. He met the clients where they were.
I want to concur with Larry about the necessity of a deeper trance level if you're doing regression, because I have been on the receiving end of several non-productive regression or parts therapy sessions because the facilitator failed to get me deep enough. I'm an analytical resistor, and if I do parts or regression with a client, it's really important that that client be as deep as I am able to help him or her go. Otherwise, I will abort that particular session and wait until a subsequent session before initiating regression or parts therapy.
Yeah, I was going to,
Because I can't see her from here.
I was going to say the one thing about people in my 45 years of medicine, people differ from one to another. They really differ, and our brains are different from one to another. And as far as the amnesia, I go into somnambulism. Am I aware that I am allowing myself to forget the numbers? Absolutely. Does that make me not a somnambulist? I don't know, there's part of me, and yet other people, they absolutely have total amnesia, right? I'm aware of the amnesia, but I'm still, so that's the variation that exists. And I think one of the things is recognizing that your clients vary like that. And you'll do the Elman induction, and maybe to get them even deeper, you'll have to do it. Let's do that one more time. So like they're halfway in somnambulism, and then you do it again, forget the numbers, and boom, they go in. So it's just that variability that Michael was talking about, the flexibility, right? And recognizing that, like I said, people are different from each other, and you have to recognize that and work with that. But the Elman induction is such a wonderful way to get people where you want them to go. I use it as the base of my inductions for people. My first-time clients, I always do the Elman. My CD, The Stress Buster, has Elman without certain things because I'm not there, right? When I teach people self-hypnosis, come to the office, you show me your Elman induction, your short one that you could do yourself. It's a beautiful stepping stone for me, and I really like it.
Many moons ago.
Wait a minute.
1949, it must be something about medical hypnosis.
I got a call from Elman McGill, who was a very good friend of mine, and he called me out of the blue. He says, Mike, I have this gig. I really didn't want it, but somehow it was arranged for me to do a stage act in Boston. I'm coming in. Would you like to meet me for dinner and hang out? I love this guy. And I got a bus and I went to Boston to see the show. He didn't know the venue he was going into. It was a small, loud bar and everybody was drunk.
Oh.
Now, that was my memory of the experience. Sometime later, this person approached me and said, I saw you in a stage act. You were great in Boston. I said, I wasn't in a stage act in Boston. He said, I have it on film. I have it on VHS. I said, I wasn't on a stage act. You're mistaking me for somebody else. He says, no, it's you. I have you on video. I said, that's crazy. Sure enough, he shows me a video, and I was doing Elvis Presley. The thing about I experienced was that during the separation where he was ending the show, you can actually see him lean over, put his arm around me and say, there's no need to remember any of this, Michael. And even when I was watching the damn video, I had trouble thinking that was me. Looked like me, moved like me. Who the hell is that? So I would say that I had a full amnesia experience, and it was as simple as, there's no need to remember any of this, Michael. So that was one of my experiences. I was promised a copy of that VHS, and at the time I believed the guy, and I didn't take contact information. I never saw him again.
Oh, ouch.
But there was me in Boston.
So you're still not quite sure, huh?
They sure as hell look like me.
Thank you, Michael, that's fun. Teresa?
I was just going to say, I think that everybody goes in at the level they need to, and it's going to vary from one situation to the next. Case in point, my brother. He's not one that would ever go into a stage show. He wouldn't go in deep enough to do hallucinations and everything, but like he came to me to stop smoking. He believed it works. I was confident. He stopped smoking. We then worked with him because he was going in for quadruple bypass. He's our miracle man. He's almost died many times. But in the middle of quadruple, he was frightened. So we used relaxation. We deepened as much as we could. We gave the suggestion that he will relax with the chingy-changy sounds, and the more sounds he hears, the deeper into relaxation he will go. He goes and has the surgery. They bring him out. Now, when you have quadruple, you don't come out of the anesthesia for like 12 hours, and they have somebody sitting right there. And the nurse said, "Go. You can talk to him. He may or may not hear you, but go ahead and talk to him." And I walked out. Now, one of the suggestions I gave him was, if the doctor says your name, then you will respond, and then you will go right back into a very deep state. So I walked over to him. He's just out of surgery, 12 hours before he comes out, and I says, "Hey, Chris, it's me." And his eyes went, "Whoop." And the nurse went, "Ah!" And I went, "Ah!" I learned things backwards. And all of a sudden he scrunched up, and I said, "I'm scared, right? I mean, I learned it's my brother." And I said, "Oh no, relax, go deeper." And he just went right back in. He stayed in for 12 hours. The only one he remembered seeing was me. Jumped forward 4 years to the spinal meningitis and the chronic pain, and nothing was working. He had compartmental syndrome. He had to slice his leg open and everything because it was very bad. And I walked in, he said, "Trace, can you do something for this pain?" I was scared. "It's my brother." I said, "Sure." Sleep. Confidently. And he just went,
Wow.
and it was like, hot damn. And I brought him out, and he said, "God, can you teach somebody else to do that when you're not here?" And I said, "Of course I can." I looked at the nurse and I said, "Put your hand on his forehead." And I went, and so the nurse goes over, and he just goes, I got a call from the doctor's office the next day. They wanted business cards. But did he remember? I mean, is he going to go into a somnambulistic state when we're just, I mean, everything is subjective. Everything is the circumstances. It depends. If somebody needs the help, trust me, they're going to go in. If they need it, they're going to go into that full, whatever they need to do to get where they need to go. My thing is, don't make it more difficult than it needs to be. Figure out what they need. Ask them sometimes, "What do you need?" And they will tell you, and I'll give it right back to them and work like a charm.
And I had to activate an immediate resistance because she activated my instant trance trigger. And if I hadn't have consciously resisted, I would have slumped down on the table.
That would have been so fun.
That would have been
Okay.
Wait, you don't remember the dance you just did?
You're Elvis Presley.
Okay, so now that we're on this topic, I'd like to put out there, what are some of the pain management or pain control techniques that Elman taught, and also that you've put into your own practices? So I know we have some people here that work within the medical, working with the medical profession. So who would like to start off? Teresa, would you like to start off?
Okay.
Now that we're on it. I don't know if everybody knows what you do, and Banny, so maybe you could.
Oh, well, I'm obviously in childbirth, and obviously that can come in handy. Of course, we teach that if you stay relaxed, childbirth was never supposed to be painful. And I do believe that 100%. And I've had women that have actually enjoyed their labors. I've had 2 women experience orgasm with labor, and yet most of the women, I've had 50 of those buggers. I mean, good God. But for the most part, a lot of women find discomfort. So there's obviously, the quicker you can teach them to relax, the easier it's going to be. I'm also the accountant. That's the other side of my life. So I'm that one that nobody ever wanted to work with in hypnosis school. I'm never going to go into that 6th stage somnambulistic. I do with myself because I know what's on that CD. But other than that, I'm not going to get there. But I'm very susceptible to waking suggestion. If I respect you and you tell me something, I will take the suggestion. And I don't know if any of you know Ron Esslinger. We did trainings together, and I remember him telling me about his grandson when he got hurt, and in a little southern accent. Let Grandpa take that away. Grandpa's just going to throw it away. And here I'm one who's never gotten to get to the levels that I can get other people. I burned my hand in the oven. You know how bad that hurts. It hurts worse a half hour later than when you first did it. And all I thought of, and I had it in my head, Ron Esslinger's voice, I did not put myself into a deep state. I'm in the kitchen, it's a half hour, and it's like hurting. And so I just, in my head, I'm just going to throw that pain away. I wake myself out because it stopped. And it's like, you do this for a living. But it really is that effective, that quick. I have worked with people. My son's girlfriend had a hangnail, toenail. I like to pick things. Nobody wants me near them, the children and stuff. But I finally talked her into, her toe is swollen. I mean, it's just swollen. And you got to cut it and you got to pull it out of the skin. And she looks at me and she says, this is going to hurt. I said, oh no, this part doesn't hurt. I promise. She lets me take these scissors. Now this is a typical Dave Elman thing of just telling them it's going, no, this part doesn't hurt, right? They could rationalize. I dug into this and I cut and it oozed. And I'm thinking, good God, this has to hurt like that. And I go to pull it, and I get the tweezers, and she says, no, this part's going to hurt. I said, no, that's why I give you the tweezers. If you do it, it doesn't hurt. She took those tweezers, and she pulled that nail out of her toe. Anybody else would have been screaming. I didn't know any better. I just said what needed to be done at that moment. She respected me. It works. It really is that simple.
Though there's strength and there's challenge sometimes with waking suggestion.
Mm-hmm.
With a 2-year-old at home, she falls one day and I go, oh, this is easy. Let's just take the pain away and let's call over our dog Blossom and she'll eat the pain, she'll be fine. And all of a sudden the cry goes away. And it's 2 weeks later and down the hallway I hear, Blossom! So do we have to compound the suggestion? Sometimes we don't.
Oh, that's funny. That's
I'd like to make an observation. How many of you have noticed that kid falls down, I'm now speaking about a 2-year-old, on a playground, and mommy will say, oh, Jimmy, come here, mommy kissed the boo-boo and it'd be all better. You've all seen that, right? It's built into our DNA. It's a parental thing you may have learned from your parents, but it's natural. The human race has been using waking hypnosis for anesthesia for probably about 1 million years. And it works most of the time. And if it's done right, it works all the time. And it's built right into all of you. Those of you who are parents, I'm sure have done it once or twice. Make it a habit. Use it with your clients. It works. All you've got to do is have the expectancy and the confidence, and all they have to do is if they got a need to get rid of that pain, it goes away. So if they have a need and you have an expectancy, end of problem. It's as simple as that.
You know, one of the things that I think at least affects how I approach this is the views about pain have changed substantially in the last several decades. And once we had this concept of physical pain, and I don't think that concept is realistic anymore. I think that my medical opinion would be that pain is perceptual and subjective. It's not physical. And that changes a lot of things. So what I have noticed is if you follow an Elman protocol, it remains effective. And I believe it's the power of the protocol, the expectations, the beliefs built into it. And I have moved in other directions because I view pain differently these days. And that's given me a certain thing, so it's in my toolbox. If this is not working with a client, this is an old reliable. But I think that Elman would want us to develop flexible toolboxes. I think he would want us to continue to experiment and continue to pay attention to the medical paradigms. What was perfect about what he did and when he did it was he fit a paradigm, and that made hypnosis acceptable, at least to a group of people that he was interested in reaching. We have to keep that in our awareness today. Medical perceptions are constantly changing. And I think that that's an important thing to consider, especially around time. Completely different view of it. What do you think? You're okay.
Well, I think it boils down to remembering that the brain is what perceives pain. And until the signals go up the spinal cord to the brain, it's just signals, so that we can turn it off. And just the understanding that we have that power. And the other thing, about children, remember, children are in that alpha brainwave more often up until about 7 years old, and that's the beginning of hypnosis, the alpha brainwave, right? So when you lock onto that idea, and the child locks onto the idea, right? And just like lock onto the idea that as long as you hold this pencil, you cannot gag. So that expectancy is there. And again, that expectancy that you have the power to shut off the pain, to turn down the dial, whatever it is. And that, so what Elman was teaching us is really what that perception of the brain, that's it. How we perceive pain is how it's going to be. If I choose now to pay attention to my torn disc, I can bring back my pain, so it works. It really, really works quite a bit.
Can I add something to
Sure.
that? On the flip side of how the brain perceives pain is also how the brain perceives relief. Larry, on that CD I gave you, that I thought your dad was on, it talks about a study that they did with a woman who had a terrible accident and her arms were in such pain, nothing worked. And the hypnotist gave her the suggestion that there was a color or something, and the color was fading, and she got no relief whatsoever. So he brought her out, and they talked about it. And he said, "What would make you feel like you could get relief?" And she said, "I don't know, maybe a warmth or something." So he put her back in, and now she's sitting in front of a fire, and now her arms are soaking in that heat. The pain was totally gone for the first time in 6 years. There's so many things to learn. There's so many avenues, kinesthetic, auditory, visual. There's so many things that we can learn, and you got to just kind of be open-minded and take it all in. And when you're working with somebody, one of those little tidbits are going to sink in. And it's just going to be a matter of finding their way to get them where they need to go, which is going to be 10 different people, 10 headaches, 10 different relief mechanisms.
So
But they've got the answer.
demonstrated the importance of staying flexible.
That's right. That's
Indeed.
right. Exactly.
Client-centered.
Exactly.
And this is, I think, the hallmark of Elman. He codified something. He set up protocols, but he was flexible. And that was the most exciting thing about his work for me, was that he was able to be flexible at a time when there was nothing but rigidity. I think that's part of his legacy.
I've worked,
Can I follow up on that, Michael?
Yes.
I was in what I believe was the third time he gave the course. I'm basing that on when I know he started and how long the course ran and some other things. And I think I was in the third, maybe I was in the fourth, but I was in an early class. And Dad stressed certain things that were of a convenience to the sort of doctors he had in that class. He had predominantly certain specialties, general practitioner, OBGYN, a couple of other specialties. And he would stress things that were of use to them, but he would always say to them, if there's a problem we haven't addressed, bring it up in class and we'll all discuss it and see if one of our other techniques that I've just taught you can be modified to handle it. Well, by the next class after that, by word of mouth, 2 or 3 other specialties showed up. When I went through the course again later, he had a much larger repertoire. His repertoire was being built by the doctors asking a question and saying, gee, I did so-and-so that you taught me and it worked, but now I have a patient who needs something similar, but it's not the same. Where do we go from here? And so you have an evolution of the process. So that the course he was teaching in 62 was not the course he was teaching in 49. Now, there's one thing about this I'm very proud of. I went to visit, I lived several hundred miles away at this time. I went to visit my father about 2 or 3 months before he passed away. And it was a sort of a family reunion, and we're all around the dinner table, and we're all, you know, just being a family. When the phone rings, my mother doesn't answer it, comes back in, mentions a particular doctor, will you please take the call? Dad comes back from the call, asks my mother to get certain records out, and immediately starts constructing a blind, double-blind test to be run by 3 or 4 other physicians in the same specialty in other states than the guy who phoned in. Because he said, but the guy said, gee, we could add that to our repertoire if it works for a larger number of people. He's got, you know, a small number that it worked for him on his particular patients. Is it his pattern? Is it where he lives? Or is it a generic thing that can be used? So here he is 3 months before he died, setting up a very careful scientific test of an expansion of the methodology. So I totally agree with what Michael has said, that he laid down this framework, but I also agree with Michael that he retained the flexibility to add to it. Now everybody here knows the DEI. I suggest to you there's more in the book than just the DEI, because all of these other things have been added in as needed. Now, you read, and you're reading a, quote, medical book. No, you're reading a hypnosis book that is phrased in a medical context. Read a particular procedure that he introduces for the doctor and say, what is comparable in need among my clients with a different presenting problem, but it may psychologically be the same problem. Pull out of the book and change to what you need for your client. Remember, the whole thing evolved. It hasn't stopped evolving. You can help it evolve. You come up with a good idea, spread it on Hypnothoughts. Hey, this worked for 10 of my clients. Can anybody else make the same try and see if this is something we can all add to our toolbox? That's what Hypnothoughts is for, and that's something my father would bless.
I wanted to make some comments while we're still on the topic of pain. Although I haven't done nearly as much work with pain reduction as you have, I did work part-time for 7 years with the Franciscan Hospice using pain management reduction hypnosis for hospice patients. And I found the 3 techniques most commonly chosen by the patient would be peaceful place meditation, imagine feeling comfortable emotionally and therefore more receptive. Then I would use object projection, and I think all of you know what that is. Take the pain, give it a shape, color, a size, project it outside yourself and shrink it. And pain dial, the 10-to-1 pain dial. Now, I have used all 3 of those on me because I have a disintegrated disc I had a horrible prognosis. I was supposed to be a chronic pain patient for life on daily pain meds. Through the benefits of hypnosis and self-hypnosis, using those 3 techniques on myself, I'm able to live a normal life. But I do not mask the pain completely because there is an injury there, a defect. If I overdo it, I need the pain to warn me to prevent further injury from my back. So unless you have a doctor's permission, you don't ever want to totally take away the pain if it's from a past injury.
So what I was going to say is that I think part of what we haven't talked about is I think that one of the things that we can get from, and I'm sure that you can know this, is that Dave Elman loved people. He was a people person. And a great deal of what we do was relationship-based. And that he had this skill. He found people interesting. He liked them. He enjoyed the relationship in helping them, the idea he could help them. And I think that's one of the things we want to consider as part of the legacy, that we want to like and really enjoy helping our clients and being with them. And that's a huge factor in all of this. It's one of the techniques.
Thank you.
You're welcome.
Any questions?
I was wondering if anyone could speak a little bit to kind of the genealogy of David Elman's approach. Like who he learned from, or certain elements like fractionation, where that came from.
My grandfather was I'll call him a hypnotic hobbyist. My father's earliest memory concerning hypnosis was when my grandfather was talked into trying to help with a girl who had never stuttered before, but suddenly was stuttering. Just sudden onset of this. My grandfather did a successful induction. Once this girl was induced, the stuttering totally stopped, but he did not know how to give a post-hypnotic suggestion. And he had no concept of following to cause. So the result is, when she was emerged, came out of hypnosis, stuttering went right back in again. And you're talking about Fargo, North Dakota, which was a frontier town. They still had stagecoaches and they had covered wagons, and basically it was a John Wayne movie set, is what my father grew up in. And including a bank robbery, by the way, in the style you would get in the Western. And the robber happened to be the guy who drove the local school bus, which was a hay wagon. I kid you not, this was one of the traumas of my father's young life. So anyway, the emergence is done, she goes back to stuttering, and in my father's mind, and in the minds of her entire family, hypnosis does not work. But my grandfather's following it as a hobby. About 2 years later, he's got what will be terminal cancer. He's in severe pain, and he knows a hypnotist who comes and relieves the pain. If you go back and examine the various stories about this I've gotten from my aunts, uncles, cousins, etc., the things that have come down in the family, although my father never mentioned it to me, and my father may not have even consciously thought it through, Grandpa must have been taught self-hypnosis as well, because not only was the pain relieved, he was able to keep it relieved while he went back to work for a short period of time before he died. He died at work, okay? He was traveling salesman at that point, and he died on the train. But he must have been able to keep it up with self-hypnosis. So whoever relieved the pain was a good hypnotist who gave him a lot of these tools. My father observed these. When my grandfather died, my father talked all of his siblings into allowing him to retain Grandpa's hypnotic library. My father was a voracious reader, and he read every book in there cover to cover, and then he'd experiment on school kids. He's rather obnoxious on this. The terror of the playground, going over to kids and let me hypnotize you. And And he was also a pest. He would go to the local physicians and say, I've observed so-and-so. You as a doctor, why is that happening? He could be obnoxious on this. And by the time he was 12 years old, he had developed what we now call the Dave Elman induction. And in fact, we had a celebration of its 100th anniversary in Zurich 2 years ago. In developing it, if you asked him later on, as I did, where did it come from, he would name a whole series of books that he had read out of Grandpa's library. But there were two that he had read more than once and that he considered to be his guiding light. They were among the ones he forced me to read before he would allow me to take the class. And I'll recommend them to you today, and I'll tell you that one of them is such an impossible read that I suggest you read it, but if you take it 2 or 3 pages at a time, okay. And that's Bernheim. Bernheim's Suggestive Therapeutics. It's a superb book showing the thought processes in the late 19th and early 20th century concerning how the human mind works, but the insights of it are true to this day. So you'll find the language kind of difficult to follow because, for one thing, Bernheim didn't speak English. It's been translated muddled. For another thing, it's in the thought processes of those days. And for a third thing, he's a lousy writer anyhow. So it's tough. But, go read it. The other one is Henry Monroe, and his is much easier to read. The problem with Monroe, as I learned when I put something up about him on the internet and got my bottom kicked by people who researched it and found that Monroe was exaggerating, was that Monroe is a good fish salesman, but on the other hand, he has a lot of wisdom. So read him, but keep an open mind. Anyway, this was the genealogy of what my father knew of hypnosis. When he went into vaudeville, he had, as my wife said, many different parts in vaudeville. If you understand vaudeville, you've got a limited number of people in the vaudeville troupe that arrives in town who's going to spend a whole week giving shows twice a day for every day of the week. If one of them gets sick or trips and breaks a leg or whatever, some other member of that troupe has to do that job. So everybody could do everybody else's job. So Dad did a lot of these other jobs, but it was quickly found that he was the best one to do hypnosis because he really knew it. He didn't have to fake it. So he became the troupe's stage hypnotist. And in that role, he began to find various problems that were definite to hypnosis. To give just one of them, and I won't go through all of it, I'll shorten it down. One of the things that scared the hell out of stage hypnotists of the time was hypnotic coma. We call it today Esdale. My father developed a way of getting a subject out of Esdale that was unique and was the only one that kept the stage hypnotist out of jail. And he taught the other stage hypnotists this as a professional courtesy. There were other things he developed in that time period. So that's where all this was generated. He gets to New York, where hypnosis is in very ill repute. He meets up with a lady whom he falls madly in love with at first sight. And he doesn't want her having a bad impression of him. So he doesn't tell her he's been a hypnotist. Let's see, 30 some odd years later, I'll figure out the math at some other point. 30 some odd years later, he's running the Hobby Lobby program, and one of the guests on the program is a hypnotist who blows his entire act, just totally screws it up. And my father, to save the show, steps over to the man and says, "You've done such a phenomenal job, Mr. Jones. Well, I bet these people would even take a suggestion from me." The guy knows that he's blown it. And he says, The next voice you hear will be Dave Elman's, and he knows what he's talking about. And he runs off the stage in embarrassment. And my father then goes into what I didn't know at the time, I learned later, was an old-style vaudeville hypnosis show. And he completes it fine. We get in the car to go home that night. My mother turns to him and says, "So Dave, how come you know more about hypnosis than the stage hypnotist?" And that was when he first admitted to my mother that he knew hypnosis. And started teaching it about 2 years later. So does that answer your...
Yeah, that's great.
Great story, isn't it?
Surprising.
Any questions from the floor?
That reminds me of the guy who told his wife he was a pimp so she wouldn't find out he was a lawyer.
Yes.
So I'm just curious, I've been interested in helping my wife, and in 1980 she ended up with a pain in her left hand, her left arm that runs from her shoulder to her elbow. And none of the doctors could do anything. They've come up with theories of why it's there, and we have x-rays to prove why it's there. But they still don't know why it's there. And so far, nothing has touched it, no meds and all that kind of stuff. And I'm just wondering, since you mentioned pain earlier, I haven't given up. I am curious from an Elman technique and his legacy, what path could I possibly pursue that might actually end up in some results of an unresolved pain that nobody's been able to touch. She actually solves it by taking a brush of a certain texture, and she brushes her arm. And in Santa Cruz, California, they invited her with a whole bunch of physicians in that semicircular thing to have her demonstrate pain control, which is basically just swamping the pain with giving multiple inputs with her brush, and that's sort of spread around. But the underlying pain has not gone away.
That sounds like it's going with the different nerve fibers. There's alpha fibers and different fibers for acute pain and chronic pain, and that's why people with the TENS unit, will mask the pain, or if you start tapping yourself like that, you're blocking some of the other pain fibers. But what I would suggest is possibly going into regression and finding out where was there something happening before that pain? What was going on before that pain? Is the pain trying to tell her something? If they really can't find anything wrong.
Well, physically, they've done an MRI.
Yeah,
and
I
there's an
would regress.
malformation.
I would think that my first thing
But I
is
like
there
yours.
an emotional issue going
Yeah,
on
what was going on
that
just
somehow
before?
was unrecognized, and this is serving a purpose, and I would just explore. Doesn't mean it has to be. Is there a purpose for that?
Well, I have a curious mind, and part of my curiosity goes in the opposite direction. And I know, I've had instructors say you can't cause harm. But I'm going, what if there's an oops? I mean, what if I increase the pain? I actually don't know what I'm doing in that particular case. And I wouldn't want to turn the dial in the wrong direction. I mean, I want to keep my wife. I don't want her to point to me and say, he gave me more pain. I mean, I'm just saying, that's part of my nervousness.
Teresa had her hand up there for a minute.
I actually, one of the best clients that I ever worked with was a man that had been in a car accident. Now, this was a man that intimidated me more than a little bit because he had his PhD in biochemistry, another PhD in biophysics. I have 2 years of pre-med under my belt. I don't even have a 4-year degree. He found me by accident on the internet. He had been hit by a car and thrown across the street in a coma.
Ouch.
He was crushed from here to here. He had to pick up his arm, nerve damage done, and he developed what was called RSD, reflex sympathetic dystrophy.
Dystrophy.
They think it's a neurological. About 3 million people in the country have it. No cure. He'd been to everything. I was the last resort. And when he came in, I mean, I literally thought, oh God, what did I get myself into? I mean, I had a doctor referral and everything, and the referral said Mark can have anything underlying that will help him with his meds or his pain. Sometimes we peel the onion, sometimes we can cut right to the center. We peeled the onion. And we laid the foundation by just getting him into a very relaxed, Roy Hunter, happy place. And he was a very deep candidate. Now, this had happened 2.5 years before, and he was 52.5. His goal in life at the age of 50 was at 55, he wanted to be in the best physical shape he had ever been. So he'd been going to the gym 4 times a week, he'd been walking so many miles. The only reason he survived this accident was because he had been in such good shape. Once the physiological reason for the pain goes away with RSD, they don't know why, the pain gets worse. And it usually is from a trauma to arms or legs or whatever. And to even walk up to him, if he could sense that you were near him, it was like tetanus, like nails on a chalkboard. You couldn't even approach him. So we just got him, and he had told me that on a scale from 1 to 10, with 10 being the worst pain, he had been the level 8, 24 hours a day, 7 days a week for the last 2.5 years. Maybe 3 times he could remember getting down to a level 3, sitting on a couch thinking, oh, I'm at a level 3, for about 15 to 20 seconds. That was it. The one thing I did with him, and Mickey, the hypnobirthing, her and I were slinging back some wine one time, and I said, sometimes I don't feel qualified. I'm not a doctor, and I'm not, I haven't had specific training. She goes, you're not a doctor, and you're not a psychologist. You're a hypnotherapist. Listen. Have them talk, and talk, and talk, and talk, and talk, until they tell you what they need to heal, and then toss it out to the universe and wait for the answer to come back. And I thought, okay, that's the stupidest thing I've ever heard. Accountant kicks in an awful lot. So I lay the foundation for this man. I'm scared to death. And the one thing I said, he said, look at me. I wanted to be in peak physical shape at 55, and look at me. How ironic is this? I said, how old are you? He goes, I'm 52.5. That's when the universe got back to me. I said, I guess that gives us 2.5 years to get you there then, doesn't it? Now, the very next week, and this is very common with childbirth as well, the whole thing that causes pain, and this will be good for your wife too. The thought of pain causes the body to tense. They're afraid of the pain. They're more afraid of the anticipation of the pain than even the pain itself. That causes them to tense, which then causes tension in the body, and that causes pain. Use your arm. Very easy, doesn't hurt. Tense it up. Now it hurts. This is the difference between a easy labor and a painful labor. I used my hypnosis for birth techniques on this man because as he was telling me about the pain, he had his legs crossed, either his feet. And he says, the pain starts, and then as it gets worse, and that foot started going faster, he says, and then when the pain gets really bad, and all of a sudden he lunges forward. In my house I work out of. My poor kid thought I was getting killed next door. Scared the bejeebers out of me. Mommy kicked in. My kid's panicking. I just said, stop that! I swear to God. And he just, I said, sit back and count yourself down. I taught him self-hypnosis, Roy Hunter 101. And he counted himself down. And he totally relaxed. And I'm sorry, this is his words, not mine. He goes, I don't fucking need this. And I'm like, yeah, now. You can keep at that level, and when you're ready, just stay calm like that, and you can open your eyes and come back to the room. The one thing I gave him that nobody else did, when I picked up that file and said that gives us 2.5 years to do it, was hope. He didn't have any. He says, Trace, I put my feet in sludge. Because we became friends. I worked with him for a long time. So they can suck the negative ions. I've been to every possible therapy there is. Nothing works. I quit coming to you because that very first session, I got him down to a level 3. And he stayed at a level 3 for 3 hours. He already had his miracle.
Wow.
So by the time he came the next week, which is when we went through the whole screaming thing, and I screamed at him because I was scared to death, he got down to no pain. We actually got him to the point that I could 1, 2, 3, pain's a 10, 1, 2, 3, gone. And he'd relax. 1, 2, 3, on, 1, 2, 3, off. We could show him on, off. Sometimes it's secondary game.
He's in control.
His father was a chiropractor. He was a biochemist, a biophysicist. He got tired of doing that. He became a marriage and family counselor. This man was never going to be, and his father never thought he was good enough. And I even got to the point that I said, Mark, you're a biophysicist, a biochemist, your dad doesn't think you're good enough. I'm thinking maybe we should go see a shrink too. You okay? He did the shrink thing too. We got him to the point that he could get in the car and be on his way to my house, which at first he couldn't even drive himself. He was in no pain from the second he was on his way to come see me, the whole time he was with me, until he got home. I would love to work with him now because I feel like I've honed my skills a lot in the last 10 years. But he got himself to the point that within 2.5 months, I didn't realize he was 6'3". He lost 40 pounds, and he went from being housebound to actually going back and working and putting on a presentation for 200 scientists, at which point the pain got really bad, and instead of walking off the stage like he normally would, he said, excuse me, and he had a chair right there on the stage, and he sat down, counted himself down. He said, I got myself down to a level 3, not gone, but level 3. I was able to finish my speech, and those men in the audience were crying because they had seen me before, and they knew that I was done, and here they watched this. All I gave him was hope. The reason he stopped seeing me for a while was because he realized it was in him. He was a scientist. He wanted pills. He wanted meds. He did not want to admit that the power was here. He did come back. We got him totally functional, and I'd love to do it. I would love the opportunity to work with him. He's back east now, but we're still friends. What I'm going to suggest for your wife, hate to say it, but even when it comes to childbirth, my own relatives don't come to me when they're pregnant. What could I possibly teach them? I'm an aunt, I'm a mom, I'm a whatever. Maybe have somebody else work with her.
Yeah, it doesn't work when I yell.
I would echo that.
And don't take it personal.
I'm going to offer an alternative here. And one of the things that I think is very important to say is just because we're effective at helping somebody doesn't validate our hypothesis or theories about why we're effective.
Right.
We really don't know. But there's a lot of information that suggests needling, tapping, and brushing produces the release of endorphins. And that automatically reduces pain. Endorphins are our feel-good chemicals. It's not that the pain goes away, we feel so damn good it's not important anymore. It loses its urgency. The second thing I want to say is this idea of turning pain up actually is an effective technique. It's much easier to turn pain up a little bit and then turn it back down. It's more challenging for somebody to turn the pain down.
It's also a fractionation of pain. Take it up, take it
If
down.
you take it up, now you've implied if we can raise it, we can manage it and take it down.
Wow.
So now you take it up, you bring it to baseline. You take it up a little higher, you bring it to baseline. You take it up a little higher, you bring it to baseline. And now you start decreasing it, and decreasing it, and decreasing it. And that tends to be a very effective way. RSD is a very strange thing. They've been studying it since the Civil War. It has 70 different names in the medical literature before it was called RSD. And the strange thing is the most prolific writing was during the Civil War, where people had bayonet wounds and or lead bullet wounds. And it was very common in that era. It re-emerged in the construction realm. When people are on construction sites and they have a minor injury, they step on a nail, they don't think about it, 6 months later they have RSD. They step on a shred of glass, they don't think about it, it's a minor injury, 8 months later they have RSD. One of the amazing things about this is how it's diagnosed. One of the diagnoses is thermographs. The injured part of the body tends to be considerably cooler than the rest of the body. And that decrease in temperature seems to affect the nerves and how they perceive pain. There was a hypnotist I met several years ago who had RSD himself. And based on the doctor showing him the thermograph and him seeing, this is my normal healthy foot, this is my injured foot, and he was on the verge of suicide at that point, the pain was relentless. He said, what would happen if I used hypnosis to raise the temperature? He went into remission, and the thermographs demonstrated he actually elevated the heat level of that area back to normal. He was so excited about it, he went to his doctor, who now gave him evidence of what he did himself. And he said to the doctor, do you have other patients with this condition? The doctor did. And he worked on about a half a dozen people. This is in the Michigan area, where he used imagery of raising the temperature in that area. And in raising the temperature in that area, the pain went into remission and the condition seemed to resolve. And there was actually thermographic proof that physically the physiology changed in that area. So I might experiment with that kind of imagery as well.
Yeah, thank you so
You're
much.
welcome.
I'll share a specific example that has some very strong Elmanian principles behind it. He was maybe 18, 19 years old, and he comes in, and it's this pain condition that he's being researched by all these different facilities, all these different hospitals, all these different universities. There's a small collection, and I'll have to look it up later to find out which one it exactly was. And I'm hearing two statements from him in our first session. Everyone who's tried to work on my pain was a complete idiot. Nothing they did worked, and I wouldn't even do the stuff they would do. So basically, they give him a protocol to follow, and he wouldn't even take the pills, he wouldn't follow with the therapy. But of course, that stuff doesn't work. So they're giving him the map, he's not even getting in the car turning it on. So, and again, everything so far has been, he has become a specialist in trying to work on his pain. So thinking in the back of my head, let's just do something entirely different. First of all, we need to address the compliance. And back to the original text. If you follow my instructions today, I believe I can help. If you don't follow my instructions, I don't know what will. How's that sound? So I've got compliance. And in that session, and then you saw the shift in him immediately by just accepting his role in the process. Everyone else had been working on his pain. Let's go somewhere else. And just on a hunch, I bring him all the way into Esdale and just kind of let him hang out there throughout the session. Come out, go back in. And at the end of it, never once during the session bringing up the concept of his pain, because that's the problem. Just from the principles of let's bring him there, get the natural anesthesia, the natural euphoria, just see what happens. And I'll shorten it, but with a lot of colorful language, he's there asking, what was that? In beautiful ways that I love to paraphrase elsewhere. So, and just that theme of, it's just that foot in the door. It's that hope that there's another option there. It doesn't have to be that. So by working on, in my thought, just working on his comfort, let's just go somewhere else that you haven't been in quite some time, because the similar feedback is day to day, at its best, it's maybe a 7, at its worst, it's a 9. So he's staying in that tight range. And let's just go there intentionally and just see what happens was the theme. So rather than working on his problem, let's just go somewhere else and just let things naturally develop. And I'd say working with him was interesting because that from that point forward, and I hate to simplify it, just to borrow the quote, hope was realistic. Everything from that point forward worked.
Well, you increased his comfort level.
There wasn't a technique I couldn't throw at him that didn't help him. Just because we had that foot in the door, we had the opening wedge that, oh, there's another option.
Well, give her hope, check the thermograph, raise the temperature, and just take her to a place where she has no pain.
And yell at her.
And then,
And yell at her.
And you over it, and yell at her.
The thing about it is never underestimate the power of distraction. Never underestimate the power of love, the power of touch. You know, I had a couple of clients, both male and female. They're talking about the pain, and I say, you know, I'm not a doctor, I'm not giving you a prescription, but I recommend increasing your sexual activity. Knowing in the intake they had no sexual activity. Well, I can tell you with confidence their partner loved that. But the amazing thing is their feedback was, you know, it works. And, you know, I'm forever quoting experts, and a lot of times I make those quotes up. So, you know, I've been reading research. The latest real research shows that during sex and orgasm, you release a wide range of chemicals that produce pain relief. And if we could get you in the habit of producing those, we could start producing them on post-hypnotic suggestion.
I quote you.
Just try it out. He's a freaking genius. He's a hypnosis rock star, by all means.
My husband's a urologist.
Wait, give him the...
My husband's a urologist, and he writes a prescription for this guy who has prostatitis for the wife because more sex will massage the prostate gland.
Oh, awesome.
Now going to the RSA, I'm really, I've had quite a few people with RSA. The two that actually had it go away were two children. They both had injuries to the ankles, and their parents came to me early on, which is very important, in pain also, because they now know that the sooner tools like hypnosis to manage chronic pain, you don't get into that loop. So that docs, who are working with pain should actually use us sooner rather than later. Because once you get into that loop, your nerve actually learns how to go to that high pain level.
Yeah.
Now, so the two children I had emotional issues that were attached to that injury. And it amazed me that their RSD actually went away. But the one lady I had again, emotional issues, but hers was with a scar from surgery, and it's complicated emotionally. But I'm thinking now that I wish I had known that about the heat. Coming to these things, you never know what tool you're going to pick up with.
Yeah.
And I think that's been
Well, my wife has
absolutely
given up on
fantastic.
herself, and she's given up on her pain. But see, I love her so much, I haven't.
Good for
It's
you.
much easier to understand her learned helplessness and hopelessness. And it's very important that you're there as a support person. That's what I think the first thing that needs to be addressed is. In our profession, we're taught to think of it as secondary gain. We're taught to think of it as resistance. And in my experience, which is extensive, more often than not, it's learned helplessness. It's learned hopelessness. So you got to come home. I went to this conference. I heard all these exciting things. There's hope for you, honey. I'm real excited about some of this. And these people are really experts. Play it up. Milk it. And then you begin to do that. The first challenge is giving her a reason to believe she can get improvement. From there, everything else falls into place.
What city do you live in?
Salt Lake, my wife's in a hotel, I abandoned her to come here, but she's supporting me from a distance, not far away.
Great. Thank you. Adrian?
Michael, when's your Hope is Realistic talk?
Tomorrow at 8:30, some sadist. Some SOB scheduled me at 8:30 in the morning on Saturday. So it is.
I may be inappropriate. This may be inappropriate. It's your call, but would it be okay to invite her to Hope is Realistic?
Definitely.
That's a good idea.
I-
That's a
yes.
really good idea.
Yeah.
Thank you.
Yeah, thanks, wow,
Thank
That's
you.
a great idea.
Questions?
thank you.
Comments? Yes.
Someone who I think doesn't get enough questions about is your mother. And the roles that she's played, because my understanding is she was quite a teacher, and I think she was accredited for hypnosis or some other.
No, the coma, inducing the coma state, yeah. Obviously,
Would you like to tell a little
he's
about
got
that
to take,
first?
no, no, I think this is
Okay.
the Colonel's question.
Okay. He knows it also. We've discussed it at length, so. But my father, as I already indicated, had found the emergence for Esdale back at a time when that was a major issue for stage hypnotists. When I went through the course for the first time, he taught that, and he said to the doctors, the probability that you will get a spontaneous Esdale, remember, induced Esdale did not exist. Spontaneous Esdale is one in, there are various numbers quoted, 5,000 to 100,000. The point is, it's rare. He said, but on the other hand, you guys are getting X patients per week, per day, 5 days a week, 50 weeks a year. You do the numbers, and you may hit one of these in the next 2 years, 3 years, whatever it was comparable to a stage hypnotist. He said, so you should know how to emerge. And he would teach that. I was taught that. And invariably, some doctor would stick his hand up and say, okay, I've learned your theory, but I want to see one and actually try it. And Dad would say, but I don't know how to induce it. You're going to have to wait till you hit the 1 in 10,000. That's not fair. So they would pressure him to try various deepening techniques to try and induce Esdale. And he kept failing. One night he succeeded, but he had no idea how he succeeded. As far as he was concerned, it was a complete accident. So they get in the car to go home, and my buddy gives him a big grin and says, I know how to induce Esdale repeatedly and reliably. So yes, Mom invented the Esdale induction.
Oh my goodness. Wow.
Very nice.
But she invented it after Dad invented the emergence. It's sort of like mass backwards.
Yeah.
I get a kick out of this.
That was a great question, and I think that reflects something that we should be aware of. Right now, we're celebrating women in hypnosis. There was a time behind every successful man, there was a woman, but she was in his shadow. And that was a norm. And now we're seeing, that women deserve credit and get credit. So this is an important thing to acknowledge. It was a major contribution.
Definitely.
Yeah.
And I appreciate your father giving instructions on how to emerge from Esdale, because about 2 years into the profession, I had a spontaneous Esdale. And after the second failed attempt, at which time I clapped my hand, turned on the fluorescent lights, and said, now. So then I remembered what Charlie taught us about how your dad said you basically, in my perception is you have to give the client an emotional reason to emerge. So after I did, she opens one eye and says, do I have to?
Can I fill in real short the basis of Dad's emergence?
Please.
Dad's conclusion, which he's just in effect given you, is the person in Esdale wants to ignore you. That's why there's no communication in Esdale, at least in spontaneous Esdale. We'll get to induced Esdale in a moment. In spontaneous Esdale, they want to ignore you. Because they want to ignore you, they will take no suggestions. What you've got to do is get their willingness to be invested in coming out. Don't think because they're not responding that they're not hearing. They are hearing everything you're saying to them.
She acknowledged that.
So there's two things you can do when you have a client who is ignoring suggestions. And I refer to them as the carrot or the stick. They're a mule refusing to move. And just like an old-time farmer, you can either dangle a carrot in front of them and keep moving it down the road, or you can keep whacking them on the rear, but you're going to move them by one or the other. Dad reached that conclusion. That's what Dad taught. But what he did as a practical thing was in a vaudeville theater, you run into this, the stick is much faster and you've got an audience to consider. So he pushed the idea that you use the stick. But he never said that was the only way. It's a carrot or a stick. It happened that in his scenario, the stick worked. What sort of carrots can you use? One carrot you can use is, if you follow instructions and if you emerge now, I will have a better handle on curing whatever your presenting problem is. There are others, but the point is you give them an emotional reason to come out. What sort of stick? The stick I like best, and there's a person here who originally taught this to me but swears he has never used it himself. I don't believe him. Is walk up behind the client who is in this situation and whisper, your bladder is filling. Your
Just say there's no confusion. And in a moment, he's going to excuse himself because his bladder.
This lady I talked about said, I heard every word you said. But it was like being on an LSD high. I did LSD once when I was a teenager, and she said, it felt so wonderful, I didn't want to wake up when you told me to.
That's the point. They didn't want to.
A very easy way, just because you won't care, is stay as long as you like. I bill $125 an hour. Yeah.
I share from
That's an
the,
emotional way to do it.
from the perspective, I began all things stage hypnosis and then transition over to mostly clients and teaching. But there was a time, and the news story recently, somewhere in Canada, the guy that was working with, he basically had the equivalent of half of a weekend's course, and he's now the hypnotist doing the shows, and the person wouldn't emerge. The spontaneous Esdale on stage is just the biggest gift possible, because once you recognize it and you know what's going on, you just kind of walk over and pick up the arm and, yeah, you just hang out there. And you're working with all your other volunteers, giving them suggestions. This one you're doing great, and he's still with the hand up. Yeah, just like that. But there was a time
And his
where...
bladder is full.
Getting back to the original formula, you don't have to use the exact words. If you understand the sequence, if you understand the psychology, anything will work as long as it fits that gap. I never liked the threat, so I liked the benefit. I can see you're enjoying this, and the next time as you emerge, I'll show you how you can do this on your own. And in a one-on-one session with a client, that's worked the very few times that's been the issue. But I'm in this program and nothing's working, not even that. And finally, well, what are we learning from the culture of all things high school? Well, unfortunately, bullying works, so I went there. I sat next to her. Everybody's staring at you when they're ready to go home, and the eyes popped open. So again, it's the stick. You understand the principle. And it's not a matter of this didn't work or that didn't work. Just try something else, and that's what I finally did.
But there's a beauty in your utilization.
Oh, yeah.
And that's part of the flexibility. Use what shows up in your practice or on stage. That's really very cool. You know, I do the same thing, but I would play around with the idea, you know, it's even more enjoyable when you learn to come in and out.
I like that.
It's even more pleasurable, it's even more satisfying. I just slide out of it and learn to slide back into it. And I found that very, very effective. But if it's necessary, I have a big stick. I mean, you know.
Notice something here. We're evolving little tricks to handle this problem. Each person speaking has a slightly different view, and if you put them all together, we've just stuffed in a whole new layer in our toolbox. So when I said before that this is an evolving profession, and that my father's philosophy was, as Michael very beautifully pointed out, be flexible, we've just seen that right here. One other comment on Esdale, and that is today, different time period, because of my mother's invention, people go for induced Esdale. Now, induced Esdale has almost all of the same characteristics as Esdale. The difference is that because it's induced and because the person knows they're going to go there, your communication difficulty is different. I won't say it's gone away because I've seen cases where they wouldn't communicate. Tough luck, buddy. I'm going to ignore you. But in a number of cases, you can make a communications breakthrough. And this is what the Simpson Protocol, ultra height, ultra depth, and 3 or 4 other things used today utilize. They go basically for Esdale, whether they call it that or they call it something else. They go there, but they go there with the ability to communicate, and then they branch off from there into whatever technique they're using. And I've watched each of these as an observer, and that's what I see. And in some of the cases I mentioned, I then said that to the practitioner, and they said, oh, no, that's not what I'm doing. I don't know. That's what it appears to me.
How much time do we still have?
1 minute.
1 minute? Really?
No, so about 40.
No, No, what time does it go to?
5:20.
5:20.
Thought it was-
Yeah,
So-
it's 5:20.
We have 1 minute.
We have 1
We have 1
minute.
minute, so if we'd like to just wrap up, first of all, I'd like to say, I've really enjoyed hearing each one of you and all the different perspectives, and thank you very much for being here and doing this.
Thank you for inviting us.
And
We'd like to have an opportunity to pay our respects and honor them. But I think one of the things that you might go away with is that we're not competitors. We're all in this together. And as the field grows, there's a spirit of respect and effectiveness, and there's many ways to do this. And if anything, we can learn from each other. And the
Yes.
key is
Well,
to
we
keep
just learned
learning.
today
Yeah,
about that heat
that's what
thing.
I'm saying, that we can learn from each other. It's not something where you have to be in your own space. We're in this together. As we grow, the profession grows. And that's what I think is really nice about this, is we enjoy being together. And we enjoyed honoring somebody else. So I thought this panel was a great deal of fun. Really a pleasure to
now the
participate.
people that didn't show up have really missed out. You know what the beauty of this panel is that almost all these questions were different than the last time we did the panel. So I think that as it progresses and continues, there'll always be different questions, different topics, different players, and it'll be so interesting.
Why don't we do this again next year? We're all each other's teachers and
Put in,
students.
ask for it again.
It's like the legacy is still growing.
Absolutely.
Yes.
And each
That's
one
what
of you are
legacy
part
is.
of it.
And hopefully, as a medical person, that the idea of using hypnosis earlier on in medical conditions.
Instead of the last resort.
Yes. I was advised, if you want more business, do #last resort. But really, because for me, it's opened my eyes. I made a 180-degree turn in my medical, opinion of how the power of our mind. And I really think that it needs to really open up to more of the medical people. They need to find out, just like I found out, they need to find out how powerful that mind is in really healing issues and taking care of people. So.
Thank you all
Well
for
said.
joining.